I'm Frederick, a CDC prevention specialist at the Division of Social and Community Programs at Frederiksted Health Care Inc. Today, on December 1st, 2021, we observe World AIDS Day. Right now, I would like to have a quick moment of silence to remember those that we've lost to HIV and AIDS. This year, the theme is Ending the HIV Epidemic, Equitable Access, Everyone's Voice. Here at DSCP is our aim to make sure everyone's voice is heard, that we are able to provide affordable care, and we're able to raise awareness to lower the bias surrounding HIV and AIDS. We want to ultimately see a world where everyone knows their status and is provided with adequate resources to protect themselves. During today's video, members of our team will be speaking to people from different walks of life to hear about the knowledge concerning HIV and AIDS, to inform them about the services we provide in our division, and to eliminate any potential misinformation or biases that may have been surrounded around the HIV and AIDS virus.
Hi, good day. My name is Isa T. Spenner, and I work at Frederiksted Health Care. I'm the Administrative Coordinator for DSCP, and today we have with us
Anderson Joseph.
And today we would like to talk about World AIDS Day. We want to shine light on the equality of healthcare throughout our community. As you know, we live on a predominantly Black island, and the LGBTQ community is not necessarily welcome with open arms. How do you feel about that?
Well, I do feel that people is people, and what they do, regardless of their orientation when it comes to sex, that's their business. But everybody deserves healthcare, good healthcare, and deserves to be treated with respect. So that's my standpoint.
I very much agree. And do you know much about HIV?
I know a little. I know something.
So what do you know about it?
I know HIV is a disease that pretty much affects the immune system.
Mm-hmm.
And I know it starts as HIV and it can progress to AIDS.
Correct. So no, you can continue.
I also know that we have medications to pretty much make living with HIV comfortable, but I know we don't have a cure for it.
Very much correct. Very much correct. HIV is a virus that attacks white blood cells, and when white blood cells are attacked, it lowers our immune system ability to fight off illnesses and different sicknesses. So do you know who can get HIV?
I believe the answer will be everyone.
And that's very much true. Despite the many biases that there's out there, anybody can have HIV, regardless of your sexual preference, your gender, anybody can get HIV. Do you know how it's constructed? Because a lot of people believe that you can only get it through kissing and touching, which is not true. So do you know how you get HIV?
I feel there's many avenues. There's, of course, sex, unprotected sex. There'll be oral, vaginal, anal, and there's also an issue people don't really know about, but like sharing of needles.
Yes, that is very important. Sharing needles is one of the main ways you can get HIV. Like you said, having unprotected sex without a condom, anal or vaginal, you can get HIV. And HIV can also be passed down from mother to baby during the birth. So do you know what you can do or what practices you can do to reduce your risk of contracting HIV?
Practicing safe sex, using condoms, having one sexual partner, girlfriend, boyfriend, wife, husband, practicing coming to get testings regularly, always knowing your status, coming to places like the clinic, using your programs, stuff like that.
That is very much correct. We never ever want to share needles. We don't share needles, and we always try to use condoms. You know, you try to use condoms to protect yourself. And then we have these medication called PrEP or PEP that helps reduce your risk of getting the virus.
Okay.
Now let's say you was potentially exposed to it. You had a great night, and then you find out like, wow, I might have been exposed to HIV. Do you know what you can do to protect yourself or get help for yourself?
I would say probably come into the clinic or the hospital and pretty much let them know.
Okay, yes. So that's your first thing. You want to come to the hospital, to a clinic, to urgent care, some type of medical office. What you have to do is come within 72 hours of the exposure. They're going to prescribe this pill called PEP. And what PEP does is it reduce or eliminate your risk of getting HIV all in all.
Okay.
You take it for 28 days straight, and on the 28th day, you come back and you get tested again for HIV. Usually, with that case, you don't contract HIV.
That's good to know.
Here at FHC, we have so many different resources, especially in the DSCP division, where we dedicate ourselves to help the community become more knowledgeable of the different risks and factors surrounding contracting HIV. We have free testing, free STD screening, we give out condoms for free, you name it, we have it. Medication, different programs that you can go on if you happen to contract the virus. Like, there's a whole lot. I truly want to thank you for taking your time out your busy schedule.
Anytime.
And sitting down and talking to us about your knowledge and what you know about HIV. And we hope to see your face again.
All right.
Good day, everyone. My name is Che Richards, and I'm a CDC prevention specialist here at Frederiksted Health Care Inc. in the Division of Social and Community Programs. Our work here that we do here is very important. We offer free rapid HIV testing. We host a amount of field testing events where we offer incentives, and we are just here to educate the community more about HIV treatment and safe sex practices. Ultimately, we just want to save lives and make the community a safer place for everyone, especially the underserved community. Here with me today I have
Jonathan Williams.
Can you tell me a little bit about yourself?
Sure. So I was born and raised on St. Croix. My family is originally from Trinidad and Venezuela. I grew up here. I went to school here, and then I lived probably for about 9 years away, just at college. I went to school in Vermont, and then I lived in New York for about 5 years after that. And so I've been living and working back on St. Croix for 6 years now.
Oh, that's awesome. Okay, so you were born and raised here on St. Croix.
Yes.
Can you tell me a little bit about your experience with growing up here in St. Croix?
Right. So I think that my early childhood was really great, and I credit having a really strong family unit. And I think that, as someone who identifies as being part of the LGBTQIA community, once I started to go through puberty and just got to be a little bit older, things became a little bit more difficult. I wouldn't say necessarily with my family, but I would say definitely within the community that I reside in on a larger scale. So it was, I would say there was a fair amount of bullying, there was a fair amount of, now in today's world it would be characterized as hate speech and hate crime type situations. And, growing up in the community that I live in, it wasn't necessarily something where you could speak up for yourself. It was more that it was just part and parcel of being part of the queer community. I prefer to use queer because I think it's all encompassing, and yeah.
Okay, so basically you experienced bullying
I would say so.
occasionally growing up here on St. Croix.
I wouldn't even say occasionally. I would say that it was at any point in which I was just sort of like in a public space, so away from, when I was younger it happened at school, but less so when I got older. It was more just being in public spaces where there was just a larger cross-section of the community present.
Okay, so the World AIDS theme of 2021 this year is ending the HIV epidemic, equitable access, hearing everyone's voice. And that directly coincides with the work that we do here at DSCP. We want to offer access to to care to everyone, regardless of age, gender, and sexual orientation. There's a bias about the HIV and AIDS epidemic that it only affects the LGBTQIA community, and that's 100% untrue. But there are some unique ways in which it does affect that community. So why do you think that is so?
Well, I think you have to think a little bit about the history of the HIV/AIDS epidemic, and I think that, the reason why it impacts the LGBTQIA community is because most people, like you said, still have this idea that the HIV virus is specifically a gay disease, and that it only impacts our community. And because of that, I think that along with the fact that in certain communities, particularly in the Caribbean, being an out, proud member of the LGBTQIA community is not necessarily something that is widely accepted.
Right.
So what you have are cross-sections of the LGBTQIA community who never really come out of the closet, are never really able to live proudly and be open about who they are. And so because of that, they are reluctant to get tested. They may not be aware of safe sex practices. And so what you have is this whole community within the community that is exposing themselves at higher rates to transmission of the HIV virus.
Right.
And I think, like I said, when you think back to the beginning of the HIV epidemic, it's so funny because in the last year we've been talking about COVID and this pandemic, but for the gay community, this is our second pandemic.
Right.
And so we really, I think, because it represented such a thematic development for the LGBTQIA community within at least the United States, I think that sort of history is stuck in people's memory in terms of what the gay community is.
Right. Like, for example, like Black transgender women, they are
the most at risk. So beyond just being the most at risk for HIV transmission, they are the most at risk for violence and for murder. And I think that those things really do coincide because we haven't created a space in our society that's safe for transgender women, for transgender people in general, and because, of course, of structural racism within the United States, the person that suffers the most is the Black trans woman.
That's very true. Okay, so despite the way that the HIV/AIDS epidemic has been affecting the community, we have there has been a lot of scientific advancements in terms of treatment, which a lot of people don't know about. My colleague previously mentioned PEP, which is a pill that you take within 72 hours of potential exposure. You take it for 28 days, and that should protect your body from the virus. There's also something called PrEP.
So PrEP is pre-exposure prophylaxis, and it's there's one sort of, I guess, there's two pills, but they're basically the same sort of scientific formula. There's Truvada, which was the first that was sort of created, and they're both by, I think, Gilead Sciences, and the second was Descovy, and Descovy is a recent advancement that is supposed to be gentler on your kidneys, because I think there are some trials that have proven that prolonged exposure to Truvada can cause some kidney issues later on in life.
Okay.
But because they're both new drugs, it's very difficult to see what the long-term effect will be on people who take it. But essentially, if you take it as prescribed, which is daily, I believe you reduce your risk of contracting the virus by, I believe it's 96%.
Okay.
And the other good thing about it is that if you are seeing, which I do recommend, seeing your doctor and having these conversations with your doctor, you are required to have HIV and STD, STI testing done every 3 months, which is just a really good practice. I think
For
everyone,
everyone.
right,
Yeah.
everyone who's having regular sexual encounters with even the same partner, different partners, it's important just to know
Everyone.
your status.
Yep.
And so that's one really great thing I think about just being on a PrEP regimen is that you do see your doctor every 3 months, you review your sexual health, and then you're just aware because, like has been shared, having HIV is not a death sentence anymore. There are lots of treatments for it. And it's funny because PrEP was developed from a treatment for HIV as a meaning of prophylaxis.
Mm-hmm.
But the most important thing to do is to know that you have it, and so then you can be treated. And I think one of the things that's sort of talked about in the community, or people may have heard but they don't even know what it means, is U equals U, which undetectable means untransmittable. So if you're being treated for HIV, if you do have the virus, but you're being treated, what can happen is that you can get your viral load down to a point where it is undetectable by any regular HIV testing. And what that means is that you cannot transmit the virus. And so HIV is no longer a death sentence. It's no longer something that you will absolutely pass to a partner if you are on top of your sexual health.
Alright. So I think the major takeaways here is that we need to work towards ending both the HIV epidemic and the HIV related stigma.
Mm-hmm.
And that will make it easier for people to feel more comfortable with even being courageous enough to get educated about care without having the fear of being discriminated against, so that they can have safer sexual practices. And we just ultimately want to save lives here. That's the work that we do here at DSCP. So yeah, thank you so much for coming in, Mr. Williams.
You're welcome.
Thank you. This anything for the cause and to end the HIV/AIDS epidemic.
Absolutely.
Thank you.
You're welcome.
Thank you for coming in.
Good day, everyone. My name is Edwin Nieves, and I am a homeless case manager as well as the outreach lead specialist here at Frederiksted Health Care for the Division of Social and Community Programs. And today I'm here with the lovely Miss Luz Maldonado. And today we're celebrating World AIDS Day. World AIDS Day's theme this year is ending the HIV epidemic, equitable access, and everyone's voice. And today, Ms. Maldonado is going to tell us a little bit about her experiences as a consumer here at Frederiksted Health Care. How are you doing today, Ms. Maldonado?
Well, good morning, Ms. Nieves. I'm
Good
very
morning,
welcome.
good
Thank
morning.
you for having me.
A pleasure, always a pleasure.
Thank you.
Tell us a little bit about yourself, Ms. Maldonado.
Okay, my name is Luz Maldonado. I was born on the island of St. Croix. I moved away from here at the age of 5 years old. I went to Puerto Rico to live with my extended family. It's a long story coming back. Attended school here, worked here, my family is here. And one of the things that I'd like to express, that also in St. Croix, I contracted HIV positive.
Very positive. So I could say that you was born and raised
Yes.
Crucian.
Yes.
So you, how long, if you don't mind me asking, have you been living with HIV?
I was diagnosed with HIV in 1994.
1994, wow.
Mm-hmm.
And your thoughts on when you first contracted it, how did you react? What was, at that time in 1994, I know we didn't have the technology, the medicines that we do now. How was that? How was that experience being here on St. Croix?
It's always nice to go back to remember where I came from when it comes to the HIV. I found out because at that same time I had already entered the rehabilitation center at the village.
Okay.
Because I had a substance abuse problem. And while in waiting, one of the things that they do is they will take you to the clinic to get your test. At that time, my beloved friend, Donna Christensen, she was my doctor. And as you said, Mr. Nieves, there was a time when they had to go and make cocktails which is because they didn't have everything that we needed. But she was professional and nice enough to be able to know that at my early stage, what would she like to do for me? When she called me into her office, I know I was going for the HIV results. I knew a little bit about it, but I didn't care about it because I didn't think it would affect me. Right? I think I'm a statue, I'm a rock stone, nothing hurts me. So when I went into her office, she was very nice, she introduced herself, I know her and everything. And there were 2 results that she gave me. She first says, do you know about syphilis? I said, yeah, I've had syphilis since I was 18. She says, well, your syphilis results are clear, but do you know about HIV? I say, I'm getting educated. So she says, well, I have some news for you. You are HIV positive. And the only response that came from me was, and that was it. Now, having to leave her with such an impacting answer for me, a result, I had to take this back to the rehab, which was a very good thing for me because I wasn't giving the time to run. I had someone with me in the rehab, which if somebody comes out with you, they call it a strength. That's your strength. If anything triggers you, if anything is wrong with you while you're out there, my strength was supposed to look at me and say, you okay? And she did. So we went back to the rehab, and I took the opportunity to share with the 2 most groups that attended with me in rehab, which was I live in the women's house. At that time, the women's house consisted of 16 women in one house and 22 men in the men's house. So I came in, the director of the program, his name was Al Swan. He was there with us, and he said, I want you to take a risk. I was a risky person before HIV, so I had no fear of. So we had a group, they did the group, I shared my information, and it was well received because all of us were just going into training of what is HIV, getting our lives together and all the risks and everything that we did. So that was very easy for me to do. It was like, a load off my shoulder. Then I had an assignment that one of the therapists told me, I want you to write a letter to anybody, and you're gonna start this letter by saying, I am afraid to tell you that. I chose my daughter. I wrote a letter, a 7-page letter, because it was like, I wanted to tell her where I was, how I was doing, but I had to incorporate my HIV status. So I said it, I read it, I gave it to the therapist, and when she came back with the response for me, it was like a test, reality check, risk-taking. She said, excellent. But it was like, okay, I passed that test, but I know that it wasn't a grade 4 class. It was a grade to see where I was in my level of comfort. So that opened the door for me. Then I was able to share it with the milieu, all the staff, the males that work at the rehab, because I said, if anything happens to me, you guys need to know how to deal with me. And that just opened the door. After I left rehab, everything was good. I started a women's group because I wanted women to know that I had something that I needed for them to know. And that, it made it very easy for me. I came out in the newspaper, front page. Oh, I was working at the village, so I came out in front page. I came out in the editorial twice. So that to me has not been an issue to where I feel afraid of letting anybody know that I am HIV, that I live with HIV, right? And then I got married. My introduction to my husband before we met is, my name is Luz Maldonado and I'm HIV positive. And his response was, okay. I've been married for 18 years. He is negative. I would like to think that God first, I am not HIV positive because I understand that I've been a mess for so long. And most of the time, over for 10, 12, 15 years, my tests are untraceable. My results are untraceable. And I understand that once they are untraceable, I cannot pass on HIV.
Absolutely.
I don't take the risk of saying, oh, I can do it, because I am very careful with my sex partners. I'm a one sex partner person. And I take my meds every day. He's negative. So, I feel like I'm in a good space when it comes to being able to speak about myself, being open about my relationships in general, because I don't have no fear of sharing anything.
The bravery, tenacity that you have, almost 26, 27 years you've been living with this.
Mhm.
I could imagine you went from something that we didn't know nothing about to now 2021 where technology, medicine has advanced.
Mhm.
You came out right away, family, friends,
Yes.
people around you.
Yes.
How is, with the stigma, injustice that we LGBTQ people living with HIV/AIDS here in the U.S. Virgin Islands tend to get? You somebody I would idolize
Mm.
because you such a strong person that went through this journey. I want to know, was there ever a time where it was a rough journey with the people around you, with the community, with services here on the island?
I would like to say, it was kind of difficult opening up to certain people. Because again, I mean, I think it's more difficult with family. You know?
Then at that time too, the ignorance of information and not knowing what this is.
Yes.
You know, I have family members who had HIV and died of AIDS,
Mhm.
and I remember people didn't want to drink from the same glass or
Mhm.
touch their hands or shake or a hug.
Mhm.
You know, those are those times.
Mhm.
How you dealt from beginning to with this?
Well, like I said, family is the hardest person that you have to share the information with, because you already have your issues going on in there. So for me to bring something of that magnitude to people who are not ignorant to the information, the only person that I really felt sad and sorry for, that she rejected me, and with her own right of not understanding, was my mom. You know, and
It's okay. So Camilla, this is why.
she's dead today. But like you mentioned about the drinking in the cup, I had that issue with my mom. She was like, "Are you gonna have to bring your own cup, your own spoon, and your own fork?" I said, "I have it. I got it right here. I'm not gonna stop eating from you because you are afraid that you're gonna contract HIV from me." And I was able to explain, "Mommy, you can't get this from drinking in my cup. You can't get this from sitting in the toilet. You can't get it from giving me a hug. You can only get it by blood, sexual semen, breast milk, that's not even sweat. So you have nothing to be afraid of. You just need to be able to let me be comfortable in sharing the information with you so that you can know how to deal with me. Because I'm not gonna stop coming by you. I am not danger to you. You are a danger to me. Because my immune system is messed up. So whatever it is that's going on outside of my immune system, I'm the one who has to protect myself. And HIV is not a thing that by saying HIV is gonna spread on anybody. So that was my only rejection. But I think it made it easier for me to be able to say, I'm not gonna use this one rejection to close the doors for everybody else to know.
Yes.
And then after that, I started doing interviews as of 1994.
Wow.
There's still, people would still say, "Oh, I still see you on the TV." Because I wanted to be early on, let's hear about this scary information, I became the face and the voice of HIV. Like I said, I came out in the newspaper. And I thought the newspaper was just gonna be asking me to tell them about my job as an outreach worker with the village that used to be in Smithfield. It came out more than that. It came out to be brave woman, exposes like her HIV status after completing rehab. So that's two good things in one. And I'm coming out with a picture with condoms in my hand, but it wasn't about no condom, But I was able to open to everything, and then the information just continued. I got more and more interviews, and it made it easier for me. Because I have to deal with people. We all are people persons. We cannot just lock ourselves in a hole because we feel that we carry a neon sign. My neon says, I live with HIV. I am a survivor of HIV. I can do this. And if I've been doing it for the longest time, I always tell people in anything. You can ask me anything because I have been through all walks of life.
So not only a consumer, but a pioneer
Yes, yes.
for people living with HIV.
I am a
AIDS.
hero.
Yes, you are. Yes, you are, Ms. Maldonado. Now, with this year's World AIDS Day theme being ending the HIV epidemic, equitable access, and your voice, do you feel that you, 26, 27 years living with HIV, living in a community where stigma, injustice towards this kind of information, you know, comes back at you, do you feel that you could say today, 2021, do you have equitable access? Is your voice being heard? Do you feel that with as much information and medical information that we have, you think we could stop or at least end the HIV epidemic?
It takes one. It starts with one. And all we have to do, I mean, if we're dealing with ending the HIV epidemic. I just came back from an awesome IPT summit that we had in Puerto Rico, and that is the topic. And I was telling one of the persons who were in charge of the whole training, we came up with the 340 getting to zero. And everybody talking, and I'm like, 340, and I'm like, 40. So we're like, that could be a good PSA. You have two people walking, we know what we're talking about. I scream out 340, and you over there getting to zero, and people will be like, what are you talking about? We just have to find ways to be comfortable in our own skin, to say, I want to be a part of this. It doesn't matter if you're not, you don't have to be HIV. You don't have to live with HIV. You could be living with diabetes. You know, everything is considered such a big voodoo. Like, oh, HIV is nothing. HIV to me is high in vibes. High in vibes. I am a survivor. I used to run the support group for 10 years. It was called the Survivors Club. I used to run the group in St. Thomas for 10 years. And I understand the people that wasn't comfortable, they didn't want to come out. I was told that they would go to other places to get their medicine and their treatment because they didn't want people in St. Thomas to know. And the only thing that I say, why are you afraid? What are you afraid of? You have to take the risk. So for me, FHC has been an anchor. And not because of it being in Frederiksted or Charles Howard not being the way it should be. I am just willing and able to go anywhere where my services are available because I am the one who needs to stay well. I am the one who willing to be healthy.
Yes.
And the services are being offered. If I know that I refuse a service, then I'm closing the door on myself.
Absolutely.
When you mention stigma, I know that I feel personally, I stigmatize myself.
Okay.
I'm the one who stigmatized myself. It's how I feel about my own self, my self-esteem. But I know that I understand that for some people it may be a challenge because I feel it. HIV is a sexual thing. So it's considered dirty, you know, like sex workers, like
The stigma behind
prolonged
it.
dirty thing that, but God, we're made through what? God said, create,
Absolutely.
you know, have sex and multiply. But it's how we do it. You know, we just have to be careful. We just have to know our status. And if you are not HIV positive, get tested.
Get tested.
Before you start a relationship, find the risk. Take the risk to ask the other person. Have
Grown
you
up.
been tested for HIV?
Absolutely.
I am only willing to I want to be in a relationship, but I want to give you the opportunity to say if you're willing to deal with the HIV of either one of the persons.
Not only are you a consumer of FHC, but you're a consumer of our Ryan White program.
Yes.
Can you tell our viewers a little bit of what services the Ryan White program has offered you here at FHC?
There are too many.
There are too many.
There are too many services, but however, everything in FHC is made with the consumer in mind. And I know that all the other different services are here. Thank God that I don't need them. Because I say it in a joke. If they, the doctors, wouldn't say that I am HIV positive, I don't think I am. Why? Because I've taken care of myself.
And you're undetectable.
Yes, undetectable for maybe 10, 15 years.
Oh, that's
You know,
transferable, absolutely.
So I am grateful for all services. I mean, I get my dental, I get my pap smear, I get my mammogram, I get to travel, I get my HIV medicine, I get everything.
You're living a normal, healthy,
Yes, I am.
loving life.
Yes, I am.
And which is the goal, which is that whole ending the HIV epidemic. You have equitable access to services that we have here at FHC. And for somebody who not only listens to people's voice, but you are a strong voice and a very powerful person to have here on St. Croix, especially with the information and the life that you have lived.
Yes. One of the things that were denied to me, because they were denied, and because they know I love them. One of the things that they gave all consumers, I mean, and I was there for a minute and I was, well, I can get them. They insure, which is there every month, and then you can get a voucher every 3 months, you know. So it is not something that even though I know it's available, I don't use it, not because I don't need it. I always say, let it be there for somebody who need it more than me, but I hope that when I need it, it's there for me. And I'm always sharing the information about FHC. I tell people, I am the Alliance Facilitator and Outreach Specialist, and I am a LCE, which stands for Life Changing Expert.
Yes.
So I'm always involved in everything. I am soon to retire next month. So now here I am, what do I do? I'll have a lot of free time. I just became involved with the communication committee with the IPG group. Because that's something that it helped me, whoever was doing it, somehow done that it helped me. So now I am willing to take the baton and just keep running with it and see who else we can get on board.
Awesome, awesome. One last question, Ms. Maldonado. Do you have any advice for anyone who is scared, reluctant, ashamed, for whatever reasons, to go ahead and get tested, know their status, and go ahead and get these services?
One of the things that I know, I mean, we're talking about stigma here. One of the things that you need to do that I did, let me keep it in the I. One of the things that I did, I just had to tell myself, if I don't share this, nobody will know. And then nobody can do anything for me or about it with me. The advice that I always give everybody, like I said earlier, if you're looking to start a relationship, and even if you are not, it's always good to know when you go to your medical appointments, just make sure that you ask them for an HIV test, just because you want to know. It doesn't have to be for your own, it's just that once you get that result, you pass that stage, and then you figure, okay, is this something that I want to share with somebody, is something that I can do to give somebody the information? Because everybody's going through things in these times. These are very hard times, but we still have to continue to live. So my suggestion to anyone in general, man, woman, if you're sexually active, just get tested. Make sure you check for STDs, for your STIs, for your HIV, and there is no shame. There is nothing to be ashamed of, because again, HIV can be just like diabetes. But it's how you take it, how you accept it. As, oh, I'm living with something else again. But guess what? I am grateful because, like I said earlier, I don't think I have HIV. But I don't think I do, because I'm healthy. You understand? I'm healthy, I feel good. But knowing that I do, I'm always aware. I'm very aware. I don't have to say it, I don't bring it out. There's not I don't walk with a loudspeaker saying it. But I know my place, and I know how and what I need to do to continue to stay well so that I can be of help to somebody else. So just please, when you come to your doctor's appointment, just ask for the STDs test, take your HIV test.
Once again, thank you, Luz Maldonado. It has been a pleasure and an honor to have you here today and giving us your experiences of what you've been through living with HIV here in the U.S. Virgin Islands.
It's been an honor.
Thank you. Once again, we would like for the community to go ahead and celebrate with us World AIDS Day, which is December 1st, 2021. Ending the HIV epidemic, equitable access, and everyone's voice. Thank you.
Thank you.
Good day, my name is Justin Ramos and I'm a CDC prevention specialist. This World AIDS Day on December 1st, we remember all those we have lost and all those affected by the HIV AIDS pandemic, and the selfless caregivers, advocates, outreach workers, and loved ones who have helped carry the burden of this crisis. We also rededicate ourselves to reducing HIV infections and related deaths by continuing our vital work towards ending this epidemic once and for all. The time is now. Get tested.